This is an exam preparation session. So those who are attending exam preparation sessions, please write down the important point. Please keep one notebook and two color pen along with you so that whatever the questions and whatever the important points that I'm going to discuss, you can write down. Fine. So the first question, Gravida 3, Para 2, present to the maternity triad unit after amniotic membrane ruptured at home. The fluid is noted to be cleared and the neonate head is engaged into the pelvis and the patient is having contractions every 5 to 7 minutes. And each contraction lasts for 60 to 9 seconds, which is a strong contraction. And an examination of the cervix finds 4 centimeter dilation and 90% effacement. Okay. And she is uncomfortable during contraction and rates the pain as 7. Which finding is most indicative that she is in true labor? So here the question says, a patient that is a mother and she is gravida 3 and para 2. What is gravida? Number of pregnancies considered as gravida. And she is there in maternity triad unit after rupture of membrane. Okay, amniotic membrane that got ruptured at home and fluid is clear. Fluid is clear, which means the amniotic fluid is not mixed with any meconium. So this is like absolutely normal. Okay, she is not in an emergency. This is absolutely normal. And the client's head is engaged and she is having contractions every 5 to 7 minutes, which is almost a good contraction. Each contraction lasts for 60 to 90 seconds. That is also a clear indicator of true contraction, which is very strong contraction. On examination, you found that 4 centimeter cervical dilation and 90% effacement. What is effacement? It is pulling up of lower uterine segment, pulling up of lower uterine segment, which is a true sign of labor. Fine. And she is uncomfortable during contraction and her pain is 7. That means she has strong pain also. And now the question is, which of the following is an indicator of true labor? Look at the options like level of pain, cervical dilation and effacement, engagement of the presenting part, and frequency and length of contraction. All these 4 are indicative of sign of a labor. But you have to select what is the sign or which of the following sign is indicating true labor sign. Okay. Level of pain, definitely during labor, the patient or the mother will have pain, but only by looking at pain, you can't make out whether this is a true labor or a false labor. Okay, so what we can do is the first option, which is not really good, so we can remove that. Okay, cervical dilation and effacement, based on true labor and to classify between true labor and false labor. This is the most reliable indicator that to confirm whether it is true labor or it is a false labor. So second option is perfectly all right. Engagement of presenting part. Engagement will happen at a term or almost at the end of term, which is not a real good sign. And frequency and length of contraction, almost that is okay. Length of contraction and frequency of contraction, if that would increase, which is indicating a true labor sign. But always you will get a true wrong answer that can be easily removed, but you will start with the two answers. And those answers will be almost similar, but you need to learn that what is a true sign of labor, what is a confirmatory or most appropriate sign of true labor. It is cervical dilation and effacement. So the answer for this question is second B. Okay, please write down what is a true sign of labor. Okay, sign of true labor. There are two labors, two different kinds of labor, like a true labor and false labor. In the coming class, we'll discuss that what is true labor and false labor. Okay, fine. And we'll discuss the another question. So next question. I hope the screen is clear to you. Yes, here a patient is planning to have an elective surgical procedure to repair an umbilical hernia, and the patient is 68-year-old and his weight is 136 kilogram. He has diabetes mellitus. Which of the following approaches would the most beneficial in order to reduce the patient's surgical risk? So what is the question's meaning? Patient who is planning to have an elective surgical procedure for umbilical hernia. So where would be the surgical incision? It will be on tummy or the abdomen where the surgery has not done, it is going to do. Fine. And what is the age of the patient? 68 and the weight is 136, which is the patient is obese. And along with that, the patient has chronic disease, metabolic disease, which is diabetes. Okay. And which of the following approaches would be the most beneficial in order to reduce the patient's surgical risk? So now tell me, what all are the surgical risk? What is considered as the risk of surgery? Basically, when we consider any of surgery, the first initial surgical risk is bleeding. Fine. So initial surgical risk is always bleeding and which will be expected soon or immediately within 6 hours of surgery, and it can be expected almost within 24 to 48 hours. Okay. Later that the complication or the risk will be expected, that is infection, which is expected of after 72 hours of surgery. So surgical first complication is bleeding. Second complication that can be infection. Okay. And because of diabetes, if patient has diabetes, what can be the complication that is expected? So diabetes definitely it can cause delayed wound healing. So in terms of this chronic associated condition, you can expect delayed wound healing. Clear? And here the patient weight is 136. Okay. Normally when we think about obese patient, and the surgery is going to do on abdomen, there may be chances to get delayed wound healing as well as wound gapping and evisceration of wound. Okay, so what complication do we normally expect in a case of obesity, which is wound dehiscence and wound evisceration? Now tell me, what is wound dehiscence and what is wound evisceration? Wound dehiscence is a condition where the wound is the edges of the wound is not coming closer or the wound is gapping here. Okay, so the stitches are not coming closer. It has to come closer, but in this situation, it is moving apart. Okay, there is no approximation. Fine. So that is considered as a wound gapping. What is wound gapping? The other name of wound gapping is wound dehiscence. Okay. And next is wound evisceration. Wound evisceration, it is a term which is protrusion of internal organ through the gapped portion. Already we said like because of wound dehiscence, what happens? The stitches of the wound which is moving apart. So there is a gap and through that gap, internal organ is coming out or it is protruding. That is considered as wound evisceration. So basically in obesity, two complications that usually we can expect, it is wound dehiscence as well as wound evisceration. Okay, so how do we prevent that or how do we avoid that? Normally, if the abdominal pressure or the abdominal area, which is like literally flabby or it is protruded, in those situations, definitely the chances of wound dehiscence are high. So this is usually expected in a situations where the surgery, when it is performing on abdomen, wound dehiscence and gapping is expected. So usually to prevent that, weight reduction is the better intervention. And then after surgery, you can give support or splinting in order to reduce gapping. That is also permitted. Fine. So we'll read the options and then we'll make to remove wrong answers. Okay. And the first option says monitor blood glucose level monthly. Blood glucose level has to be assessed to identify the healing process and to identify the sugar level, which is not every monthly. It has to be done every day. Okay, so on that particular statement is not suiting or it is wrong also. So you can remove that. Right? Second, avoid fluid overload by restricting fluid, which is not relating with the current situation. Discourage any changes in routine before surgery, which is also not really necessary. Encourage weight reduction, that is the perfect answer. So to avoid obesity related complication, you have to ask the patient to reduce the weight. Clear? This is the answer of the question. So question number 52, the answer is D. Clear? Okay, we'll discuss one more question. The nurse is discussing the human immunodeficiency virus, which is HIV, with a group of high risk patients. The nurse should state that the virus is found most commonly in which of the following body fluids. Normally, HIV, this is a virus which is causing infection to the patient. Once the patient is infected with HIV, it reduces the immunity of the patient and it can cause AIDS, immunodeficiency syndrome. Right? So, acute immunodeficiency syndrome is the complication of AIDS, HIV. HIV is a virus, and usually that get transmitted through infected blood and any of the body fluids. Okay, and commonly this is found in every body fluids, but most commonly it is expected in blood. Okay, so the correct answer for this is first one. And usually the students get confused with, usually we may think that all of these body fluid, which has HIV, but most commonly it is found in blood. And the mode of transmission of HIV, please remember what is mode of transmission of HIV. It is direct contact. That means when we get contact with any of infected blood or serum or any of fluids. Okay, so which is very very important whenever you answer any of questions, and if based on the question situation, you have to relate each and everything which is associated with this. So please remember, HIV, it is a virus and it can cause AIDS. It is a complication, and usually when a mother or anyone who is having HIV, there may be higher chance to get infections. So as a nursing diagnosis, you can create the most priority nursing diagnosis as a risk for infection. And early identification is really just important, and it can be treated by antiviral medications or retroviral therapy. Okay, so this is all about this question. And there are many more to talk about HIV, but when we learn maternity and when we learn immunity related nursing, we will learn HIV in detail. Okay. So if you have any queries, you can clear your queries, and you can, if you have any doubts, you can just post your doubts in the message. Thank you for watching. God bless you all. All the best for your exam.